والسلام على رسول الكريم بسم الله الرحمن الرحيم ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين. And we will surely test you with something of fear and hunger and a loss of wealth and lives and fruits, but give good tidings to the patient. Assalamu alaikum rahmatullah, brothers and sisters from across the country. Mashallah, jazakallah khair to all of you for giving your time up this morning to join us on this call to hear about what the latest situation is with COVID-19 and coronavirus and the impact it's having on our communities across the UK. We have a number of speakers lined up and experts from each respective field to present to you and also to take your questions. You would have seen, most of you, I hope, the work that the MCB has been doing alongside our affiliates and our partner organizations like the British Islamic Medical Association, National Burial Council, Muslim Charities Forum, Muslim Youth Helpline, amongst others. And we have a dedicated webpage for this. Zainab will share this with you again after the call. But please do pay attention to the details that have been sent out. We are spending a lot of effort and time working with many partners in making sure that the messaging that we're sending out is getting through to everybody around what they need to do and how to safeguard our communities from this virus. So without really taking too much time, because I know many of you have questions, I'd now like to hand over to Dr. Wajid Akhtar from the British Islamic Medical Association to say a few words.
Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to just share my screen so that you can see the presentation, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah wa alamin wa salatu wa salam ashraf al-anbiya wa mursalin nabiyana Muhammad wa ala alihi wa sahbihi wa sallam wa ilayhi tasliman jami'an kathira. My dear brothers and sisters, it's not normal for the doctors and healthcare professionals to be alarmist. Our job is to try and get across the information to everyone in a way that does not induce panic and that does not induce any negative reaction. And all the messaging that we've been giving so far as a medical community, as a healthcare community, has been to get across the seriousness of this situation, to get across the importance of taking action, to get across the importance of acting now. But we have reached the limit. In fact, we reached the limit 2 weeks ago. What I'm going to say may sound alarmist, but I am telling you right now, this is not alarmist enough. I'm telling you right now that this is a serious situation and that too many of our community are still not taking heed, Muslim and non-Muslim. I'm telling you right now that we need people to wake up, to be shaken up, and to listen and understand what is happening. There are still far too many people who have weddings that are going ahead with 400, 500 people coming. There are still far too many people who are out on the streets going to the shops, making excuses that they need to buy food as if they're going to starve to death. There are still too many people who are, too many mosques that are still open. There are still too many excuses being made for people to go outside their door when they do not need to do so. So this is a warning that we are giving about what is happening, my brothers and sisters, what is coming to hit us. I'm telling you right now that we are on groups with Muslim healthcare professionals from across the country, from nurses to physios to pharmacists to intensive care to microbiologists, and every single one is like watching and waiting a flood that is going to hit and is going to overwhelm. My brothers and sisters, this is a warning, and we need you all to pass this warning on to your families, to your associates, to your community, Muslim and non-Muslim. This is not a drill. This is not being alarmist to say that the healthcare system is close to collapse. The Prime Minister himself has said that the NHS may be overwhelmed. This is an understatement. Yesterday, the NHS, in the first time in history, has taken over every single private hospital in this country, has commandeered every bed and every single private hospital clinician. Because this is the scale of the situation. Doctors are collapsing, nurses are dying, and they are being put in intensive care in Italy right now. Right now, there are doctors in intensive care simply because they have been treating patients with COVID. And if the doctors and the medics and the nurses and the pharmacists drop out, where will we be left? What will happen to us? This is not a drill. Brothers and sisters, this is not a drill to say that the intensive care units, where people who suffer from this disease, including the young, you have been told again and again, it's people with comorbidities, it's the 80s. This is not accurate. Including the young are also ending up in these facilities. And if you end up in intensive care, the chances of getting out are not good. You have better chance of surviving if you play Russian roulette with a bullet in the chamber and put it to your head than getting out of intensive care sometimes. So, and people will say, you know, you're exaggerating, talking about the numbers. I hope I am exaggerating. I really hope I am. But let me tell you right now that we are preparing for a situation, literally in days, when the intensive care units are going to be overwhelmed. We're preparing for a situation where we will decide who lives and who dies. It's up to Allah subhanahu wa ta'ala. But the doctors will be deciding who gets intensive care and who is sent to die based on their age, based on if they have any comorbidities. You have hypertension, you have any medical problems, sorry, you don't get an intensive care bed. You have so many, you're over 60, you don't get it. You're over 70, you don't get it. This is the situation that we're looking at. We're staring down the barrel. This is not weeks away, months away. It's not an if. This is days. This could be days away. My brothers and sisters, we're looking at a situation where, if we just look at Italy, in Italy, the number of people who are dying are like 4 planes falling out of the sky every single day. Every single day, 4 planes falling out of the sky, everyone dying, and yet we are still queuing up to get on these airplanes. This is the situation, my brothers and sisters. Hundreds of people are dying, hundreds every single night. And Italy went into lockdown 12 days ago. And we have not even done lockdown here. There are reasons for that, but we need to stay at home. Brothers and sisters, this is serious. This is getting scarier and scarier by the second. We're reaching a situation, and Brother Muhammad Umar will talk about this, where they are running out of, there are not enough mortuary facilities or graves, and in Italy, the army is being called in to remove the bodies. This is not the situation that we need to be in. Brothers, the way someone has muted me, I think. I just need to, no, I'm unmuted. Brothers and sisters, this is not a normal time. This is not a normal message. The Haram itself is now closed. Masjid Nabawi is closed. The Prime Minister of the country has come on TV to say that you will lose loved ones. These are not normal times. We cannot behave even half normal in these times. Things have to change. The message from the British Islamic Medical Association and from the medics and the healthcare professionals across the country is very clear, is very focused, is very straightforward. We are staying in our hospitals and our clinics for you. Please stay at home for us. Please stay inside your homes. Please do not go out. If you need to go out, then in the minimal fashion possible. This is absolutely urgent now. May Allah subhanahu wa ta'ala, and again, please forgive me if I have come across as alarmist. The intention is that we need people to wake up. We need people to listen. We need people to take heed, because unfortunately, what is coming for us, knows billah, may Allah subhanahu wa ta'ala protect us from this. What is coming from us, for us, we are very, very afraid, is worse than anything that we could have imagined in our lifetimes. May Allah subhanahu wa ta'ala protect us, inshallah.
Thank you so much, Dr. Wajid. We'll be having a question and answer session with Dr. Wajid shortly, but now we have Brother Muhammad Umar from the National Burial Council to discuss this.
Assalamu alaikum wa rahmatullahi wa barakatuh. My brothers and my sisters, whoever is listening to this particular Zoom call, whatever my brother has just said is absolutely frightening for each and every one of us. What he alluded to, yes, there is contingency planning going on throughout the country to ensure that there is sufficient space available to store bodies, to make sure sufficient facilities are available to bury people. These are real times. And these are something which we all will need to ensure that we do enough planning for it from now on, so that we are able to ensure that if this calamity befalls on us and the death rate which they are predicting does happen, we are prepared for it. People still seems to think that this is not going to turn into reality. There is going to be deaths. Nobody can predict how many people will die. Only Allah subhanahu wa ta'ala will know. But we need to be prepared. There is already people who are very scared of actually handling a COVID-19 death. Even though the Public Health England has stipulated that you are able to give ghusl so long as you got protective gear, people are simply scared to go to handle any bodies. This is the true reality on the ground at this moment in time. Most of the mosques are closed. So majority of the facilities of ghusl are in the mosques. So that also poses a problem. We also have still people who are attending funerals who are not heeding the government call of trying to ensure that we have distances and we restrict the numbers coming in the hundreds. This is not acceptable. Please, Tazia, I'm sure Mufti Zubair might be able to tell you, this can be done from a distance. You don't need to be physically present there. These are times whereby we need to ensure that those providing burial facilities for the community are kept as safe as possible. If they get infected, they will not be able to provide you the service. Most of the cemeteries will close down. What will you do then? And the burial facilities. So please be very careful. Whenever anything has been asked to you, please ensure that you heed to the advice. At Gardens of Peace, we've already taken the steps to say that, yes, we will carry out burials, but in strict time slots. And also we'll restrict the numbers who come in, because we want to ensure that the visitors as well as the staff are protected, and that we continue to provide the burial facilities. The challenges are huge. We will already hear over so many people, and I know majority of the question would be on this cremation stuff. Please let me assure you, every government has to prepare for any eventualities. Majority of the governments have taken the simple option of just declaring a state of emergency, giving them unlimited powers to do whatever they wish to do so. This country at least has presented a bill. We identified the concern about the authority given to local authorities to absolutely dispose of deceased in any manner they fit, if it is required to do so. This particular provision was picked up on Friday. We immediately contacted Cabinet Office to say this is a red line. Naz Shah, Baroness Vasi, was treating immediately, started to work with cross-party, and yes, they've come up with an amendment. I know some people are asking, why can that amendment completely remove cremation? Remember, they have to balance the fact that if the hygiene of people, public health, if you have massive bodies touring around everywhere, and there's a risk to health for the greater community, they need to be empowered. It does not mean that we will be cremated. Inshallah, we will not be cremated. We need to be working actively with our local authorities. We need to ensure how we can help them. We will need to suggest storage facilities. We may need to take ownership of Muslim bodies to make sure that we are protecting them. This is something which we can do positively, rather than trying to put videos after videos after videos, which does not do anybody any good. I can assure you that everybody, even this government, will just not switch on the lights to say, let's start cremating. They will consult, but we need to ensure that we're also taking a positive act on it as well. Brothers and sisters, we need lots of volunteers in this time. We need to ensure that we are safely able to bury our loved ones. If we can give ghusl, let's give ghusl to them. If we are not able to give ghusl, we need to speak to our scholars to say, what are the alternatives? This is something which we should do proactively rather than creating an era that we are all trying to panic that we're all going to be cremated. So everybody you hear now is only about cremation. Has anybody bothered to listen and understand how many burial spaces are being made available? What are your facilities within your own borough? Has anybody done any research on that? Why is only everybody concentrating on cremation? Why do we not prepare for ourselves to ensure that we do not face that particular issue? Can you also say that legally speaking, the government under no legislation are they able to provide you with a burial? That's a legal position. But the government and councils provide you from a moral perspective. So the challenges we are facing on the ground is we are finding people who are very scared to handle COVID-19 bodies. Secondly, the guidance is that you need to have personal protective equipment. This is becoming a problem as well because they are having shortages of supply and they are having to balance between giving to frontline staff as well as the people who are actually handling deceased bodies. So this is why there was a proper guidance from the Royal College of Pathology and the Royal College of Anatomy, which said that there is guidelines that you can handle body as long as you pay minimum amount of protective clothing. So this is something which people are scared of, and I don't blame them. And specifically, we are finding that women are more reluctant to come forward because they are of the view that we are actually main family carers. If something happens to us, what will happen to the rest of the family? So this is something which is real. This is practical things I'm telling you, which we are facing on the ground, as well as we are facing that the numbers of COVID-19 deaths is increasingly day by day. We ourselves have handled already 8 cases, and there are cases every single day in every part of the country occurring. So this is reality. We need to be prepared for it. We will continue to give guidance in consultation with Public Health England and in consultation with ulamas to say when you are reaching to certain scenarios, what we need to do. This also includes questions of the nature that rather than going down the route of the most extreme case, can we do mass burials? Can we bury in a section which is not designated for Muslims? We're looking at every options which is available to us to ensure that our loved ones are buried as far as possible in accordance with our Islamic teachings and our Islamic requirements. We will continue to fight with the government departments concerned to ensure that no Muslim should be buried, should be cremated, and that they should be buried. Until, inshallah, Allah gives me every ounce of my energy will be devoted to ensure that we do not face that day when we will be forced to cremate any one of our brothers or one of our sisters. I assure you, and I'm working with the MPs, and all I require is in this day and in this time where everybody is scared, is let's work unitedly. Let's be in one ummah. Let's work together in conjunction so that we can try and overcome whatever challenges we are faced. This is why Allah is testing us. And Harun, he recited from Surah Baqarah, the ayah. This is all it is. It's a test from Allah subhanahu wa ta'ala, but we need to step up and let's work together on it. I know there are several questions I can carry on, so I would rather go for a specific question if Zainab can ask me, and then I can answer, inshallah.
Thank you so much. Do you think our community is prepared for the worst case COVID scenario? And
no, they are not. Sorry, carry on. Sorry.
And do you think we have a clearly articulated plan for how we'll manage the deaths in our community and properly equipped and staffed ghusl teams?
Frankly speaking, no, we're not equipped. Some areas are better equipped than other areas. Some areas have already started preparing for it. Other areas have not prepared for it as well. They're now only waking up to the fact that there will be deaths. Up to now, they were in denial to say that they will only be infected. Now they are waking up to the fact that there will be fatalities. And this is why each and every area, I have requested each and every area to ensure that please contact your local authorities to find out how much space you have. In the event that the existing space is filled up, what other plans have they got in place? So we're being proactive. Secondly, ask to see whether there are anybody who would wish to give ghusl and whether there is any available protective equipment that you would need in order to carry out the ghusl. If not, what is the alternatives, which we are now seeking from the ulamas to say in different scenarios, what would be the position of the ummah, what the position of the people who are carrying out funerals, what do they need to do? There are a series of questions which Mufti Zubair is aware of. We've asked the ulama, inshallah by today or by tomorrow we'll get guidance on it. We will send it to everybody concerned, because you must also face reality. May Allah make sure that that day never comes. But what if you have 100 bodies in a day that we need to bury? So we need to have practical solutions. How will we be able to deal that in the best manner possible, at the same time ensuring our people are buried? One thing we should always remember, that in these circumstances, exceptional circumstances, there may be delays with the actual burial. What we are trying to say, rather have delays than have anybody cremated. So this is why there will be some delays, and we should be prepared to accept those delays. However, we'll mitigate those delays to as much as possible to a minimum period.
On those delays, is there any guidance as to what facilities would be suitable to store these bodies waiting for burial?
At the moment, this is what we're trying to look at, temporary storage facilities. There are solutions already in place. All resilience groups have been told to look at capacity. They may bring in temporary store of mortuary facilities. They may bring in warehouses will be converted. You may even have to buy trucks to ensure that there's refrigeration availability. They are looking at all options, but every borough is looking at capacities, and every borough is making preparation, and every borough on the resilience group, local resilience group, there is a faith representative there involved in it, and they are also guiding the council, so they will also be fully aware what our requirements are from the Muslim perspective.
And is there a special process in which the janazah will have to take place?
This is also, we are asking the ulamas what needs to be done. If there is no time to do janazah, can they do janazah in absence? Or if a family is also been isolated and they do not wish to delay the burial, and so we asked for muftis that can families insist on delaying the burials until they are out of isolation? So we've asked the muftis down there, we may have to do burials, and whichever cemetery go, if it's a Muslim cemetery or whoever the brothers are, and if there's no janazah done, then the few brothers who are there, inshallah, can do the janazah on the particular person concerned. We know mosques are closed, so if there are no janazah facilities, most cemeteries will have open spaces, and if there are few of them who are there for burial, I am sure that first kafaya of doing salatul janazah will be able to take place, because you will, inshallah, be Muslims who will always be involved in the burial process of it, inshallah, as far as possible. So at least they will be able to perform that for the kifaya.
And is there any information on the number of burial sites that are available nationally?
Now, we are trying to collate that information, but all I can say, suffice to say that 90% of the burial space is all run by local authorities. There are very, very few private cemeteries around. So we are really at the mercy of the councils in terms of burial space. It's too late in the day to try and buy land and do, but it is an idea that if there is suitable land available, this perhaps would be the best time to try and instigate a Muslim cemetery, and perhaps planning would be much easier to do so.
Thank you. And there have been over 200 people that have just joined now. So would you be able to very concisely reiterate the advice for performing ghusl on someone who has passed away due to the coronavirus?
The advice to the coronavirus people who have died, according to Public Health England, you can give ghusl as long as you have a personal protective equipment and you are experienced enough how to give ghusl. And that means in terms of actually even disinfecting, wearing the correct gear, and then ensuring that it has been buried it's been properly shrouded, and then if necessary buried in a bag for extra precaution. If you're not able to do that, and that seems to be the issue, because there is still a disparity in terms of what the government guidance is and what hospitals are doing. Some hospitals are simply stating that we will only give you a sealed bag, in which case the ulamas are now trying to see whether there is a simple way of just maybe perhaps giving ghusl or water over the body bag and shrouding it, that would be sufficient. Others are insisting that they should only be buried in a coffin, and a sealed coffin. So we are waiting for, and in the bill, there are clear guidance which stipulates that throughout the whole country, there should be uniformity. So every hospital, everywhere should have the same process in place. So this is all I can say at this moment in time, because it depends on individual cases. There are so many people who can give, who are able to give ghusl, but may not do so because they don't have the personal protective equipment. We have asked the government, and I've repeated before, they are still trying to source it, and we are hoping that in the next day or so, we will try and do so. My strong advice would be, without personal protective equipment, do not endeavor to give ghusl. That is for safety reason, do not endeavor to give ghusl. That is my bottom line. If you have, then you should attempt. But if you don't, please do not attempt. That is my personal opinion, for the sake of the safety of the person concerned. And please do not force anybody. This is an individual choice. Do not judge people. This is an individual choice. If they feel comfortable, they should do it. If they do not feel comfortable, do not force anybody to do the ghusl. This is something which I don't think anybody, but we should try as far as possible to give ghusl. The only analogy I would use, that if it is your own parents and you were able to give ghusl safely, would you deny them the ghusl? That's the question you need to ask yourselves.
Thank you. When you're giving ghusl to someone who's passed away of the coronavirus, does that water that's been used for the ghusl become contaminated?
As far as I'm aware, no. As far as as long as it goes through a safe drainage, I don't think it's contaminated. But whatever you utilize in terms from the ghusl place, whatever you have used in terms of equipment, I'm talking about disposable equipment and whatever, that needs to be treated as medical waste. That's been the safety advice from HSC on that one. So you cannot just put everything in a normal bin bag and put it in a skip or something. That's not really recommended.
Thank you. And what can our communities do at this time to make sure that they are ready, that they have the necessary arrangements in place to facilitate the worst case scenario?
They can try and ensure that, what I would suggest, that let not every mosque become a place for ghusl. Let us choose in each area 1 or 2 areas where people can make ghusl. Because the issue is that after giving ghusl, you need to make sure that you disinfect everything correctly. And most places it will be very difficult. So it might be better to have 1 or 2 places which is dedicated to say all COVID-19 ghusls will take place in this place, and the others will be for the other normal ones. So this is why my suggestion would be, practically, that's what they need to do. They need to understand within their own community which 1 or 2 centers they would want to dedicate, train up people who can give ghusl safely, right? And as well, make sure the preparation, wherever, if you can, within our own community, try and work together whether we can get it. And also lobby your local authorities whether they can help you in trying to procure the necessary PPEs.
And when someone who's passed away and the body is in a coffin, can a mask be removed, and can they just be carried with gloves, or does protective gear need to be worn the whole time?
The advice is differing, but as far as I'm aware, once the particular body is in a coffin, it is just safe to just put a glove on, and gloves should be more as a minimum. Some people, where they're putting the suits and everything of that nature, as far as we are aware, it's not necessary. People are taking extra precautions to do that, because if you have a sealed coffin on that, there is no chance, because it's already in a body bag, or it's already in that. So that is the aspect of it. It's droplets which are the ones which will cause any infection. And also when you asked, I forgot to mention two things, sorry. Anybody over the age of 60 should not really participate in ghusl. Strictly, we would advise that. And secondly, you do not need to give the ghusl in the normal manner we do. So there are a lot of sunnahs and there are a lot of farais. The only farais is that you make sure that every part of the body water reaches. That's the main element of it, right? So there are a lot of things which are sunnah which you can skip through in this particular manner as long as the farais is done on that one.
Thank you. And what do you think? Do you think it's important for Muslim businessmen and women to buy land now or spare land for cemetery facilities? And is there any local authority planning issues on this?
There will be local planning issues. There is always going to be challenges because any green belt of land which you get, you will have to provide lots of conditions in the sense that firstly will be the needs statements, secondly whether we will fulfill the criteria of green belt, but there is no harm for you to prepare. What we always stipulated to people is to say that if you work in hand with the local council, it's always easier for you to get planning permission. If you do it individually, you may face more challenges. We faced several challenges at Gardens of Peace when we started our cemetery, not only from the local authorities, but also from neighbors. So it was a challenge, but it's not something which you cannot overcome. If there is intention and true niyyah, inshallah, Allah will help you to do so. So I would always encourage that if you are able to do so, but please do not think that running a cemetery is very simple. It's not a question of buying a piece of land and digging a grave. That's it. There are lots of other things which we need to take into account before you venture into that particular direction.
Where can burial committees get the required protective equipment, and is this something you are able to facilitate?
We are trying and get it from Public Health England to see if they can give us a central point or if they can do it via the NHS trusts. We have been assured that we will get clarity on that on Monday from Public Health England. The moment we do so, whether they decide to do centrally, whether they decided to do in regions, whatever that may be, I will share with everybody through the MCB, and then MCB can relay that message to the rest of the community.
And if someone passes away of coronavirus in hospital, what's the mechanism of contacting a community or the National Burial Council for help?
You can contact your local funeral directors, or you can contact the National Burial Council. We've got a website, and you've got my email address is there. You can contact us through directly, or you can contact through MCB, who I am sure would be more than happy to pass the messages to us.
Is there a facility to coordinate where burial spaces will be available to be offered to areas which don't have facilities or spaces?
This is the reason why there are local resilience groups being set up to see where there's additional capacity. If there's capacity issues, less capacity issues in a certain area, they've been told that they have to work together so that there would be a mechanism in place to utilize every existing space available.
And and we've had a few hundred more people join the call after you'd started. If you wouldn't mind quickly reiterating your point on cremation and the amendment to the government legislation.
Okay. The amendment to the bill, as I said before, the bill is there to ensure that the government has every available resources available to them to act in a situation which is a crisis situation. And that is why that particular element of the clause came in that particular paragraph of the bill. The cremation aspect of it was just done as a last resort. And when we saw that, we actually contacted the government immediately and said for the Muslim community, that's a red line, and that we should not really be cremated at all. So they have already taken that into account. MPs in terms of Nasha, Baroness Vasi, as well as West Streeting and others have already suggested an amendment. And I know people have asked to say that why do they not completely remove the word cremation, is because of the fact that they have to balance it to the fact that it is not only our community, some other communities also may not prefer burial. So there are also Orthodox Christians, there are all sorts of other people as well who also may not wish to do so. So this is something which is as a last resort. And we have been assured, and will continue to continue to pressurize them to share, that they should not really switch on that trigger point until such time that they have consulted the necessary people. They will then come back to the community, and that it will be for the community to ensure that we find alternatives. So this is not something that everybody immediately who's got COVID-19 is going to be cremated. That is false. And I just wish people would not place it in that particular manner, that is de facto, it's that you will be cremated. Let me also explain to you, right, that even though cremation is allowed in the Sikh religion and the Hindu religion, they also are objecting to this clause. And why are they objecting to this clause? Because what they are suggesting here is mass cremation. And for the Hindus and the Sikhs, they also want to ensure that the ashes of their loved ones has got religious significance. So they also are with us on this particular issue. So you can imagine if a person who's prepared to be cremated are also in objection to it. That is why we are saying we want every faith group to ensure that we try and protect this bill as much as possible, into sense that they should have as much caveats, if it at all possible, to remove that clause, but I don't think that would be possible. And that is why we've requested everyone, and through the advice of Nasha and the rest of the MPs, is please write to your MPs, simply stipulating that our faith requirements should be protected. And that is the least each and every one of us could do, is just take 2 minutes of your time to write to your MP. That will add weight to the bill, because remember, the only people who can change the bill is the people who are MPs within Parliament.
Thank you so much. We've got 3 final questions. I'll ask them all together, and hopefully you can answer them all together. Are there facilities to transfer bodies from hospitals to either the mosque or a burial site? The second question is, how can people join these local groups? And the final question is, could you please briefly explain what the National Burial Council is?
The facilities, it depends on each mosque. What we have tried to say that, you know, if you have facilities if you've got local mortuaries within your own mosque, yes, some hospitals do not have an issue you're trying to store, but our advice is that wherever possible, try not to store bodies if you can. Specifically in the initial stages, if you are able to collect the body from the hospital, try and ensure that you do whatever is necessary and bury on the same day. That will be our advice to people concerned. So there is, at this moment in time, there are mortuaries in various mosques and everything like that, but you must ensure that once you handle the COVID body, all those particular facilities need to be disinfected. Secondly, local groups, there are local groups being set up now. In each area, normally there is a burial committee. So, for example, in Leicester, there is the Muslim Burial Committee organization for Leicester. In Bolton, there is a Bolton Council of Mosque. In Birmingham, there is the Birmingham Muslim Burial Association, and so forth in all the areas. So you can just contact them locally. They will give you good advice from that aspect of it as well. And what is that NBC? National Burial Council was really set up as a body for all the people who are involved in funerals and burials to come together as an umbrella body to ensure that we share good practice, also to ensure that we can become a body who can lobby to government to say that this is what our community requirements are. So we have successfully done for having no postmortems, or at least allowing for CT scans, for proper registration, to allow for out of hours. All those things are done through it, so that as a body, we are able to lobby government to say that this is what we can do for our community, and we can learn from best practice and share best practice, so that you'll be doing something good. That is the reason for National Burial Council, and to give guidance on these issues of burials. Wherever we have got knowledge, we want to share with everybody concerned.
Thank you so much, Brother Mohammad Omar. I know everyone was incredibly interested to listen to you and your advice. Just a reminder that this call has been recorded, so we'll be sharing a recording of this call afterwards, which you can share more widely. We have a number of WhatsApp update groups and a mailing list, and a website that's kept up to date with all of this guidance. So I'll share the details of these with everyone on the call afterwards. We'll now be hearing from Brother Fadi Itani from the Muslim Charity Forum.
بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله. peace and blessing be upon the Prophet ﷺ and his family. Jazakumullah khair, may Allah bless you all, inshallah. I know we've been reminded in the beginning, and I just want to reiterate, is actually, yes, we are going through some testing times, and it's just a reminder for all of us that this life we live in is basically not really this solid and permanent. Is a test for all of us, is a bridge we are passing, and we need to connect with each other, support each other, inshallah, and of course connect better with Allah subhanahu wa ta'ala to overcome those challenges. From the Muslim Charities perspective, we see this kind of similar challenges on a daily basis in countries around the world, from natural disasters to man-made disasters and so on. And our brothers and sisters across the world, they basically suffer and struggle in a similar situation, but they stay, alhamdulillah, connected to Allah subhanahu wa ta'ala, patient, and to overcome. We've been tested here. We still, alhamdulillah, have situation that hopefully, inshallah, manageable if we listen to each other, if we work together with each other, and if we also realize that that we need to work with everyone. And this is what we hopefully are trying to do through this process. Just briefly, inshallah, is basically at the Muslim Charities Forum, which is a network of the Muslim charities across the UK. At the moment, we're reaching out, alhamdulillah, to all the charities, and we're doing a few things. Number one is we're mapping any kind of local response, and this is in coordination with the Muslim Council of Britain. And we basically also mapping any volunteer initiatives that is taking place locally. And through this, we're bringing people who are from the main charities at the moment who are really doing any local response to basically coordinate their volunteers and prepare them. It is not what we call it a secret to tell you that the challenge for all of us is going to be very, very local. So in a way that we basically encourage and strongly encourage people who are either involved or they planning to do something, and especially people from background like logistics, projects management, etc., to basically connect with their local groups. There is across the country something called the local resilient hubs, basically, or groups, where basically they coordinate with local councils, local MPs, local police, local health authorities, and so on. So for us, we really need, and the situation is still at the moment manageable, but we need to remember that things may become more difficult, that we may not be able to pass from one area to another or from one town to another. So we really need to build our resilience, all of us, to have what we call it a very localized, as one of the colleagues say, very hyper volunteers and response groups, inshallah. We also bring a national emergency appeal on behalf of the Muslim community to support both the Muslim community and others who are in need. And hopefully, inshallah, in the next hopefully 24 hours, we will get the final details and we'll share it with all of you. At the same time, we produced two guidelines, one for charities, how to survive this situation, and is basically, we need to acknowledge here the impact on our community, of course, is going to be huge, and the country, of course, in general, but especially because we're getting close to Ramadan. Our mosques are, they already start highlighting that they're going to struggle because of their running costs and so on. Our charities, they wait for Ramadan to give and basically to support people both in this country and overseas. And this is going, I mean, charities and mostly going to take a hit. So I encourage my brothers and sisters, those who now their mosques are closed, not to ignore that there is still need, there is expenses, there is need to support their mosque, to continue doing, inshallah, support their local mosque and local charities as much as possible.
Thank you so much, Brother Fadi. I have one key question. Is you mentioned a national emergency fund. Would this help to facilitate the needs of fundraising for burials?
It's basically the appeal is going towards hopefully building some sort of a hardship fund, and which will also include the cost of burials if needed through basically because what we're going to do, we're going to bring hopefully the resources into one pool, and it's going to be redistributed through specialist and local charities who are working on the ground to make sure that we cover the country as much as possible, and also support organizations like people who are supporting mental health or burial costs and so on.
Thank you so much, Brother Fadi. I am aware we don't have very much time left, so now we'll be briefly hearing from Zohra Kaku of the Muslim Youth Helpline about managing mental health during this time, and then we'll have a very short question and answer session with Dr. Wajid from the British Islamic Medical Association. So if I could just bring in Sister Zohra.
Hello?
Yeah, thank you, please.
Fantastic, great, thanks. Okay, so just a quick update in terms of what's happening with the Muslim Youth Helpline. We've been on the front line of the mental health issues for the last few weeks. So just in case you haven't heard of us, we are a helpline by live chat, email and telephone. And over the last couple of weeks, we've had quite an uptake in inquiries which are related to coronavirus. So these are some of the issues that people are calling with, and I'll just pick on a couple of them. The first few really are all about anxiety, and that's whether you have an anxiety condition before and this is making it worse. So for example, if you have health anxiety, one of the things that you do through cognitive behavioral therapy is rationalize things and say, actually, I think I'm going to be okay. Whereas in the world at the moment, there's really not that much logic that says you're going to be okay, as we've heard on the call earlier. So that's quite hard to deal with. And then there's general anxiety, which comes from the anxiety that we're all feeling, basically being kind of like a fizzy drink, where we're all kind of reading and consuming so much information about coronavirus that it gets quite overwhelming sometimes. So a lot of us are scared for our families and things like that. And so that's what we're dealing with. Financial stress is another one. And I think the government has been helpful in some ways, but also people are still confused about what's happening. We've had a few calls around GCSEs and A-levels where people are not really sure whether they're going to be getting the grades that they need and things like that. So there's essentially a lot of instability and uncertainty. There is a lot of information out there. And so what we've done at MYH is we've put together a kind of repository of information. So if anyone is interested, myh.org.uk/coronavirus, what we've done is put together a little bit of information around why mental health is such a concern, what people can do, and then a few things like tips, health advice, and things like that. And if you have anything useful, please do email it in to info@myh.org.uk. We're looking to make sure that this is kind of a comprehensive resource for people. And that is all. Thank you very much.
Thank you so much, Zohra. Just to reiterate, I know there have been lots of questions, and we'll be sharing a recording of this call on social media, and there are a number of WhatsApp groups that provide regular updates. We also have a mailing list, and we keep our website up to date with all of this information. It's www.mcb.org.uk/coronavirus. And we'll now be having a short question and answer session with Dr. Wajid Akhtar of the British Islamic Medical Association.
Assalamu alaikum.
Alaikum salam. Dr. Wajid, if I could ask you to address the importance of social distancing and how we can properly go about doing this, please.
Absolutely. Just to say one more time, brothers and sisters, you heard the messages. You heard the messages about the lack of burial space, the issues with sealed coffins and ghusl and people getting infected. Prevention is better than cure. We don't need to go there. You heard the messages about the lack of intensive care beds. We don't need people to be decided like they're doing sometimes in Italy, that this one has gray hair, let him die. We don't need to wait to see the body bags again and lining the corridors of the hospital or army to come and take them to a different place for us to learn the importance of social distancing. What does social distancing mean? Close the door of your house and stay inside. Simple as. Don't, like, if you go outside to get some food because you're completely run out of food in the house, then go and grab that and come back in. Be careful. Imagine, and people, this is the easiest way to do it. Imagine that you already have the disease, nauzubillah. Now act accordingly. Everyone you go and see, everyone you touch, everything you touch in the supermarket, and someone else comes and touches it later, this is within 10 contacts, someone may die. So the importance of social distancing is got to be reiterated. I'm begging, all the medical community is begging the general public. We don't need Boris Johnson to tell us when to pray or when not to pray. And we don't need the government to tell us more than they already have. Everyone seems to be waiting for the lockdown to come from the government. The government has to look at it from 100 angles. They have to look at the economic, the social angle. They're trying to do many things. But save yourselves and save your families and save your community. You don't need people to tell us what's going on. Mufti Zubair, who's here, alhamdulillah, after he had apparently hours of discussions, and mashallah, they managed to convince suspension of the congregational prayer. I'm convinced that just this action alone has saved thousands of lives, inshallah. If you pick up the phone and you speak to people who are not taking it seriously, people who are still going outside, and reiterate the importance of them staying indoors, you will be saving lives as well, inshallah.
Thank you so much. And if you could just confirm or give us any information, if you know, about how long a virus survives in someone's body, both a living person and someone who's already passed away, please.
Two things. So someone who's passed away, I've just spoken to one of my colleagues who's an expert in this area, that it's not entirely clear how long the virus will survive on a deceased body and how it will be transmitted, but it could be days. This is why the sealed coffin, the sealed body bag, and all those other precautions that Brother Muhammad Umar was talking about. And the other thing that everyone needs to know is that you could feel 100% fine right now, 100%. But you could have the disease for between 5 up to 14 days. And everyone you go and you see and you touch can be infected. And some of those people will not survive. Statistically speaking, we have 300 people in this call. Maybe many more thousands will watch this. It is very unlikely that everyone listening to this right now will be okay. That's how serious this is.
Thank you so much, Dr. Wajid. We've just got Brother Rashid from the Council of British Hajis to speak to us for 1 minute to just confirm the current arrangements for Umrah and Hajj. Assalamu alaikum, Brother Rashid.
Assalamu alaikum, can you hear me?
Yes.
Just a couple of updates, really. We've had a lot of calls, inquiries regarding cancellations of existing Umrah packages. If you have booked an Umrah package, then under package travel regulation, you'll be able to get a full refund. Another one is if you're cancelling because of your own reasons, then you'll be subject to the cancellation policy of either the airline or the hoteliers, and you need to check the small print on that. If you have got travel insurance, then you need to look at the current Foreign and Commonwealth Office's advice, which is against all but essential travel, in which case insurance will pay out. It's too early to comment on Ramadan just yet, but as things are going, I would advise everybody to monitor the situation in Saudi Arabia and whether the airspace and movement starts to move on. And again, for Hajj as well, I wouldn't panic just yet, but bear in mind that given the circumstance, anything is possible. And because there is a lockdown in Saudi Arabia, in the Masjid al-Haram in Mecca and Medina, to monitor the situation. If you are being asked to pay any deposits or contribution towards your Hajj packages, if you're already booked, then hold fire. If you need any further advice, just get in touch with us at cbhuk.org, or you can do it through the Muslim Council of Britain.
Thank you so much, Brother Rashid. We'll now have Hassan Judi, the Deputy Secretary General of the Muslim Council of Britain, to briefly go over the financial support that's available. Thank you, Hassan.
Okay. Bismillah ar-Rahman ar-Rahim. Hopefully you can see the screen with a slide.
Yeah.
So, Bismillahirrahmanirrahim, many of you will know that on Friday, 2 days ago, the Chancellor announced a range
at the main road. Here.
Announced a number of financial support packages for businesses and charities and any employer in the country. Again, these slides will be sent afterwards, but just a brief overview. Of course, our mosques and Muslim institutions are not immune from the economic impact that the COVID-19 virus will have, and of course will be
nothing, just said Swinton,
affected
so we
by
live in Manchester.
Loss of their income sources, in particular from donations and Jum'ah collections.
No way. Yorkshire.
Sorry, if I'm. There we go. Sorry, thank you, Hassan.
There is a need for Muslim communities to support each other in identifying what level of support is possible and is accessible by each of our organizations, and helping each other through the application and support process. The government job retention scheme has only just been announced 2 days ago. More details of that will be released in due course, we expect next week. Many of our mosques and Muslim institutions may not be used to or applying for support.
Oh, sorry, Hassan, I think your signal might have gone funny. If you could just reiterate that, please. Sorry, I think we've lost Hassan, and I'm aware that we are running out of time. So so I think we'll move on to Brother Haroon Khan, Secretary General of the Muslim Council of Britain, to sum up for us, please.
Assalamu alaikum to all everyone who's joined the call today who hadn't joined at the beginning. Hopefully most of you would have caught the main part of the discussion, and it seems very much so that our focus today has mostly been about the worry about cremation and the impact it will have on our communities, and rightly so. But let me just reiterate, brothers and sisters, for those of you who are listening, I think the key message that we heard from Dr. Wajid Akhtar and the messages that are coming out from the NHS, from medical professionals, from politicians, is the key about social distancing. So at the beginning of this meeting, I recited a verse about how we are being tested as Muslims. We will be tested as Muslims with life and loss of wealth and everything else. But let's not forget the other verse of the Quran, which says about saving life. It's as if we had saved mankind entirely. That actually we need to preserve life. Yes, we 100% accept that death is inevitable for us. Kullu nafsin za'iqatul maut. Everyone will taste death. But at the same time, Allah has created us to worship Him, and hence we have to preserve life. And at this very time, that we can't emphasize any more than Dr. Wajid has said, and even Brother Mohammad Amir has said from the Burials Council, that we have to protect life. We have to focus on the people around us, our families, everybody that we know, the people that are still going to the mosques. We have to make them aware how important it is that we have to keep distance, isolate ourselves as much as possible. And this is the only way that we are going to defeat this virus. So very, very important that everybody focuses on this, inshallah. So Jazakumullah khair for everyone for joining the call. Zainab, do you want to just mention some points about the meeting and what's going to be shared around?
Yes, thank you so much. So thank you everyone for joining. Apologies for the technical difficulties we had at the beginning. This call has been recorded in its entirety, so we'll be sharing a recording of this. We'll be posting it online, and that can be shared more widely for those who weren't able to join us. The MCB has set up a number of WhatsApp update groups, and we've also got a mailing list that you can join to receive regular COVID updates, and I'll be sharing the details of how to join those groups and those mailing lists after this call via email. We also have a website with up-to-date coronavirus advice, and that's www.mcb.org.uk/coronavirus. All information will be shared via email following this call. Thank you so much, everyone, for joining. Assalamu alaikum.